众朋友们，大家好，欢迎收看《活在5点》，我是今天的主持人米莉。那我们大家都知道，来了加拿大呢，我们有这个家庭医生。那家庭医生他们的工作是什么呢？我们今天很高兴的有请到了他们其中的一位 Family Doctor Derek NG 做客我们节目间。Derek 你好。So hi Derek, it's very nice to have you in our show today. First of all, can you do a self-introduction?
Perfect. Thank you so much. Thank you for having me. So my name is Dr. Derek Ng, and I am a family doctor, the medical director and founder of Terrapin Healthcare Medical Center in Toronto. My education background is I studied biology at McMaster University. I completed my studies in medical school at the University of Western Ontario in London, Ontario, and then I completed my medical residency training at McMaster University. And part of my vision was always to create a comprehensive medical healthcare center, and Terrapin Healthcare is the product of that dream.
Okay, thank you very much, Dr. Derek. So you said your vision is to create a comprehensive medical center. So is that also the vision of Terrapin?
So Terrapin Healthcare really goes back to my training as a medical doctor. When I was going through all the different hospitals in Ontario, I found that there were a lot of patients who were lost in our healthcare system. And part of what I wanted to do was help them find a way to navigate and figure out the healthcare system more easily. And so what Terrapin Healthcare is trying to do is to create a network of doctors, specialists, and healthcare professionals to deliver the best care to our patients. And in particular, I found that there weren't a lot of services that were specifically catered to the cultural needs of Chinese Canadians. So what I was trying to do with Terrapin Healthcare is create this comprehensive healthcare model that is also sensitive to the unique needs of the Chinese Canadian population as well.
Okay, thank you, Doctor. Yeah, I find it's actually very interesting because in China we have a hospital and you can find every people in that hospital. But when we come to Canada, what actually happens is we have to go to a family doctor first, and then they refer us to the specialist for all kinds of things that is in all different locations. So it is very confusing for lots of Chinese Canadians. So I think it is very good to think in this way to help these Chinese Canadians to better figure out their medical health care in Canada. So my next question will be like, what kind of service your clinic offer?
So when we say that we're a comprehensive healthcare center, it means that we want to create a healthcare center that is almost like a one-stop shop, which means we have family medicine, which is long-term care. We have a walk-in clinic which offers on-demand service so that you don't have to wait many days to see a doctor. You can just walk in the same day to see a doctor. After you see the doctor, sometimes you need medications, and so we have a pharmacy on site so that you can pick up the medications very conveniently. We also have a women's health clinic because for my training, I've noticed that women are a very important part of healthcare, and they are like a solid rock in the family unit. And so having healthy women and healthy mothers is very important for the overall health of our community. So our women's health clinic has 3 family doctors who are female who rotate, and they look after female health issues like routine female exams, prenatal exams, which means taking care of you before you get pregnant, during your pregnancy, after pregnancy, and many other women's health services. Then we also have an allergy specialist as well. What I've noticed is that in the Chinese community, there are actually a fair number of people who suffer from allergies. So one of the things we can do is refer to our allergy specialist, and she can do skin testing to check for different types of allergies and come up with a treatment plan. And then in addition to that, we also have a cosmetic clinic which has top-of-the-line lasers for laser skin rejuvenation. We have different types of injectables like Botox and fillers, and a skincare line as well. Because I think part of the word comprehensive means that we treat you from the inside as well as the outside. We treat you as an individual as a part of a family, and your family is part of a community. And so I think if you treat the entire person, then you can really help to make a bigger difference in terms of their health.
Okay, that is very nice. It's very detailed answering. I know a lot about your clinic, and it's actually doing lots of jobs that usually a clinic doesn't offer so much.
Right.
Yeah, okay. So my next question will be, as a family doctor, why do you think you are important?
So the importance of a family doctor, this goes back to what you mentioned in terms of other countries where you just go into a hospital and you can pick specialists and you can just go straight to the specialist.
Exactly.
The importance of a family doctor is that the family doctor is a specialist trained to take care of the entire human being. The entire human is the sum of all the different parts of your body working together.
Okay.
So sometimes you're right, you do need to see the specialist, like maybe a brain specialist, a heart specialist, lung specialist, but who is going to put together the whole story to treat you as a human being, as a person? That's the family doctor. The family doctor is there to take care of you before you're born, when you're born, when you become an adolescent or a teenager, when you become an adult, and even when you get older towards the end of the life. So the family doctor is there during all the different steps of your life. And they take your health into the context of your family and, again, in the whole community. So they have to think about things like how the environment, how your job, the food you eat, how much physical activity you get, how all of those things affect your life and how your life affects the lives of others. So that's the importance of having a family doctor. They're there to make sure.
Yes. To look after you, tell you there is a backup. Whatever happened to your body, you have someone you can go to.
Exactly. That's right.
Yeah. I've also heard about lots of, because in China we have annual checkup, but you don't have to do it. So I know that family doctor also offer checkup, annual checkup, or these kind of checkup. So what is the importance you think that checkup?
That's a great question. So I tell my patients that the importance of the annual checkup, it really depends on you in terms of your age, your gender, what are some of the risk factors around your life that make you more at risk or less at risk of certain types of diseases. So for example, I want to do the body check to make sure that we are doing something called screening. And screening is what we do when we are looking for something that is not happening yet. Maybe you don't feel any pain, you don't feel anything is wrong, but there are some tests that are very good to pick up a problem before it even happens. So if we are able to catch the problem at a very early stage, then we can prevent a lot of problems in the future. So that's the importance of the body check. It's also just to make sure that if there's something that is missing, or maybe the patient didn't know is a problem, we can bring it up to their attention and help them prevent things from getting worse.
So do you think everyone should do their annual checkup?
So that's a very good question. So the annual checkup is definitely important, especially when you are 50 years and older. When you are a child or a baby, there's definitely the annual checkups for them as well. Now, in terms of for adults who are quite healthy in their middle 20s to 30s, it's still a good idea to check in with your doctor every 2 to 3 years. You might not have to see them every year, but if you haven't seen them in a couple years, it's a good idea to check in.
Yeah. Okay.
Yeah.
Thank you for that. That's a very detailed answer. I think everyone should listen to it. And in the end, I want to conclude the show with a question: what do you think the future of our Canadian healthcare?
Right. So I think that's a really good question. I'm not a fortune teller, but I can see a lot of different trends in healthcare right now.
Yeah.
And what I do see is in the past, doctors used to be just the one authority voice of healthcare.
Yeah.
But now I see it becoming more of a team effort, which is kind of what my clinic is geared towards. It is to have a team of pharmacists, physiotherapists, dietitians, psychotherapists, different types of healthcare professionals who are all specialists of their own trade to help treat this whole body or the whole person, because oftentimes the doctor isn't able to do all of those things.
Yeah.
Sometimes they don't have enough time to, but I think the importance of the doctor in the future of healthcare is to help coordinate, to help arrange and put all the pieces of the story back together for that patient.
Okay.
And then I also see that technology is playing a very large role in healthcare in the future as well.
Yeah.
I predict that you will be seeing a lot of on-demand services, almost like the Uber or Lyft of medical services. So that way, healthcare can become more accessible to the general population.
Right.
And I think that's especially true for patients who are having a lot of difficulty in leaving their house, exactly, to get to the clinic. And I think technology like telemedicine can help break down those barriers and provide more effective and efficient care for people.
Okay.
Yes.
Thank you very much, Dr. Derek. Thank you very much for bringing us so much detailed information and to let us know more about the healthcare trade. Thank you a lot for coming to our show today. And 谢谢大家收看本期节目，我们下期节目再见，大家拜拜。
Thank you.